Hello everyone, I'm Dr. Ila Gupta here, fertility and IVF specialist at Fertility IVF Hospital situated in 12 Navjeevan Vihar, Malvinagar. Now today we'll be talking about infertility and the causes of infertility. Now we all know when the couple living together for 1 year and still not getting pregnant, they should seek the fertility specialist for the investigations and to rule out what is the problem, why the pregnancy is not taking place, and then for the further management. Now, fertility for the pregnancy, the in females, the ovaries should be normal, the tube should be normal and healthy, and the uterus should be normal. In males, there has to be the normal semen parameters, and the another reason is unexplained infertility. So, if we look at the female causes, they constitute 35%, the male factor constitute 35%, and the unexplained infertility again constitutes 30% of the infertility. So one by one we'll discuss about the reasons why the couple face a problem of getting pregnant. Now in females, the most important parameter is the age of the female partner. Most of the patients coming to us, they are beyond 35 years of the age, maybe because of the late marriage or maybe because of the late planning of pregnancy, both the partners working, they are more focused on to their career. So age, as the age advances, it not only reduces the number of the eggs, but also the quality of the eggs also goes down. The quality of egg means the genetic material of the egg, it starts deteriorating. So the more chances of having miscarriages, more chances of having the abnormal babies or the congenitally malformed babies. So if they plan the pregnancy, it's better to start planning early, not to delay the pregnancy too late. Another most common reason in females is the irregular cycles. Now irregular cycles can be the early cycles, can be the delayed cycles, they can be scanty flow, they can be heavy flow, they can be problem during the periods like dysmenorrhea we call as, that is the pain during the menses. So all these factors relate to the formation of the egg and the egg release. So irregularity in cycle may somewhere indicate that egg formation is not at the right time or patient is not releasing the egg at the right time. Now, in cases where the cycles are normal, there also we cannot say with surety that this is the fertile period for the patient unless and until the one cycle ovulation is documented. So this documentation is through the ultrasound, which tells us that this is the time when the egg formation has taken place and this is the time when the egg is released and this is the fertile period for that particular patient. Now I am receiving a message from one of the patient, that is Saloni Mehta. Yes Saloni, how can I help you? Hello, do you want to know anything or any query? Am I audible to you? Okay, I think there's some problem, so let's move ahead. Now, so for the normal cycle, again the ovulation has to be documented. Then if the patient complains of delayed cycles, so the most common reason for the delayed cycle is the polycystic ovaries. Only I am coming to that polycystic ovary problem. Now it's a pattern of the ovary, but when this particular female along with the polycystic ovaries has the increased weight gain or the sedentary lifestyle or the eating habits are not right, then it causes the hormonal disturbance, and when there's a hormonal disturbance sets in, the cycle starts getting delayed and there is a problem in forming egg and the egg release. So there we advise the patients, the first step is the lifestyle modification. Now lifestyle modification means to keep the weight under control, to have regular exercise and to have the healthy diet. So this is the first line treatment for such PCO patients. So as the patient starts reducing weight by 5% of the body weight, they'll see the marked difference, the cycle length will start reducing, and they'll start ovulation on time. Another reason can be they may not getting the period at all. So most common thing is the hypogonadotropic hypogonadism. Now this is a condition where the hormones, the FSH and LH hormones which controls ovarian function, they go very low. So in such cases they stop menstruating and they do not produce eggs. So those patients, we treat them by hormonal injections to produce eggs, and then we ask them to try for the pregnancy. There can be another group of the patient where they had initial periods, regular periods, but then they suddenly stop menstruating and their age can be below 40 years of age. So such group of the patients comes under premature ovarian failure. So that means they have gone into early menopause, and when we do their blood test, the FSH and LH hormones are invariably high. So such patients are grouped under premature ovarian failure. Now in this group of the patient, we can make them bleed with the medicines, but they will not be able to produce the eggs. So for them, we advise them to go for the donor egg IVF. Now I am getting a query from another patient. Does our daily lifestyle affect infertility? Yes, our daily lifestyle has a very important role in the fertility. The stress has a very important role. The more we are stressed out, the more it becomes a problem, and more the things become mechanical. So important thing is to adopt a lifestyle having yoga, meditation, regular exercise, good physical activity, good healthy diet, avoid alcohol, smoking, so that the fertility is not affected. Then we come on to the tubal factors. There are two fallopian tubes. Now, the most important function of the tube inside the body is to pick up the egg at the time of the egg release and to transfer the fertilized egg into the uterus where the pregnancy grows. So if the tubes are not healthy, if they are stuck to the neighboring structures, or any of the tube is blocked, then it again going to affect the fertility. So the tube test is very important when the patient is trying for pregnancy, to check whether the tubes are patent, they are open or not, and if they are not open, then they need to be bypassed and advise them to go for IVF. Another most important reason in female is the uterine factor. The uterus cavity is very important. It has to be normal, healthy from inside. Now if we look at, there are some congenital factors. Congenital means there are some problems inside the uterus which are since birth. So like there can be a septate uterus, there can be a bicornate uterus, two horn of the uterus. So these are the common anomalies. So if these are there, then they need to be rectified. Then there can be benign growth inside the uterus like polyps, fibroids can be there inside, or there can be adhesions inside the uterus. So they need to be corrected before the one tries to plan to go for pregnancy. I am getting a query: what specific test would you recommend to diagnose infertility and how much do they cost? Now both the partners needs to be evaluated. The basic test to rule out whether the patient is ovulating is the ultrasound that we call as the follicular monitoring. The basic blood test to check for the hormones, whether hormones are normal, like the thyroid hormone, prolactin hormone. Then the blood sugar should be normal. They should be immunized to rubella infection. For the males, the semen parameters to be tested, whether the semen analysis is okay or not. Then is a further evaluation for the tubes and other things. Another query I'm getting is, what food do you suggest to eat that can be helpful in the fertility process? Now food should be, there's no such criteria regarding the food, but food should be healthy, like more of the proteins and the fibers in the diet, the carbohydrates with the complex carbohydrate, and the healthy fruits and the vegetables, more fibers, more proteins in the diet, so which keeps you healthy and does not affect the fertility. So I've discussed about the uterine factors which may affect which may create problem in conception, and if any of the problems are there, then they need to be sorted out. Then we come to a condition which is known as endometriosis. Now, endometriosis is a problem where there's a backflow of the menstrual blood, and this forms a cyst in the uterus, ovaries and outside the ovaries. And if there is endometriosis in the uterus, it's known as adenomyosis, which again affects the fertility. So if there is endometriosis, again that needs to be corrected either by laparoscopy or by medicines, and then side by side keeps on trying for the pregnancy. Then if we look at the males, there can be two problems. One is when the male partner is unable to perform. So they can be the erection problem, or they can be the ejaculation problem. They can be premature ejaculation. So those conditions can be treated medically, and if not, they are not medically treated, then one can be advised to go for IUI. Then if we look at the semen parameters, sometimes these parameters may not be normal. There may be problem in the count of the sperms. There may be problem in the motility of the sperms, or morphologically the sperm may not be normal. So there is a criteria to assess for the semen parameters, and that is the WHO criteria. So as per the WHO criteria, the count should be approximately 15 millions. Motility, if you look at the grade A and the grade B motility, should be up to 32%. And the morphologically, the normal percentage of the sperm should be 4%. And if the criteria, any of the parameter is below these average values, then they need to be treated accordingly. So based on these semen parameters, one can be advised to go for IUI or IVF or ICSI. Then sometimes we see the semen samples where none of the sperm is seen. So those patients, they are advised to go for the hormonal evaluation. And based on the hormonal evaluation, they are advised to go for testicular biopsy or testicular aspiration to check whether the sperms are generating inside the testes or not. And then we advise them to go for these procedures, and depending upon the availability of the sperms, they are further advised to go for ICSI. That is a procedure where the sperm is extracted from the testicular tissue and is injected inside the egg to make the egg fertilized. But suppose if the sperms are not seen inside the testes, then the last option is to go for donor sperm insemination. So these are some important causes of infertility which are seen in the couple. Then comes the category of unexplained infertility, which constitutes roughly 30% of the couples. Now, unexplained infertility means where the tests are done for both the partners and they show the grossly normal features, the normal parameters, but still the patient is not getting pregnant. So those patients, they come under unexplained infertility, where we cannot define why the patient is not getting pregnant. We cannot give them the reason. So such patients, they are advised to go for IUI. So IUI is intrauterine insemination, where we check the female partner for the ovulation, and around the time of ovulation, we ask the male partner to give the semen sample, and then the semen sample is processed so that we get more cleaner sample, more neat sample, which is devoid of pus cells, which is devoid of dead bacteria, which is devoid of dead sperms, and then the sample is inseminated with a very fine sterile cannula inside the uterus, which is closer to the tubes, to increase the probability by 10 to 15%. Still, if the patient is not getting pregnant, then we advise them to move on for IVF after 4 to 5 cycles of IUI. Now here I have received a query, how to know that we should move to IVF process. Now for moving IVF is in vitro fertilization, or in layman term we call it as test tube baby. If there is a problem in the egg, or if the tubes are blocked, or if the semen parameters are not normal, the motile sperms are less than 5 million concentration, then they are advised to move on for IVF process. Or if the patient has already tried 4 to 5 cycles of IUI, is still not getting pregnant, then they are advised to move on for IVF. So there are certain criteria where we advise them to move on for IVF. If there's a severe endometriosis, the grade 4 endometriosis, ovarian reserve is poor, there's no point wasting time, then again they are advised to move on for IVF. So these are the certain causes which I have briefly discussed, the main causes of infertility. And here I would like to end my talk, and thanks to all of you for hearing me, and I hope it has benefited to you, and I hope we'll come again with many more such talks and discussions in future. So thank you so much.